Is what? I'm the reporter.
There we go.
Yeah. Hi, I'm Kim with Anatar Medicine and San Francisco Stem Cell Treatment Center with Dr. Avi Herskowitz, and we're here at ACAM. Dr. Avi Herskowitz is the president. We're here visiting with some of our vendors. This is Magellan, the company that we use to process our PRP. And so we're here with their scientist, Sean, and their owner, Doug, and we're going to ask them a few questions so they can help us better understand what PRP is, what it does, and why this device is the best that there is. So, Sean, she's a PhD. If she could tell us a little bit about PRP and how it works and how it's made, and then we'll see the process.
So when you cut yourself, you usually will bleed, and then it'll turn into a clot and you'll get a little scab. Well, the reason why you end up healing is because you have regenerative cells in your body flowing through your blood, bone marrow, and all other tissues in your body as well. And what those do is they come to the area where you're wounded, and they'll come and they'll heal the tissue. And so what this machine will actually do is sequester those cells and deliver them in a much more concentrated solution to the area where you need the most healing. So you can use it for all different types of applications. There's literature supporting the use of PRP and bone marrow concentrate as well for any sort of soft tissue issues, osteoarthritis. There's also facial rejuvenation, sexual rejuvenation as well that you can use this for also, and many applications to come, I'm sure, as also.
So I have one question for you, because there's all this conflicting information out there. Is PRP stem cells?
No, that's a great question. And technically, according to the FDA, how they regulate PRP, platelet-rich plasma, and concentrated bone marrow is you're not supposed to be calling any of this stem cells. We know for a fact that there are, in fact, stem cells in all of our blood and in our bone marrow, but because of the way the FDA regulates stem cells right now, we call this all platelet-rich plasma because most of the solution is made up of platelets, thus that's why we call it platelet-rich plasma.
And the other term that always goes with PRP is growth factors.
Yes.
So how do you define that?
Yeah, that's a really good question. So the reason why platelets are so regenerative is they have these little pockets inside of them called alpha granules, and inside of those little pockets are all of the nice growth factors that are kind of like the traffic control officers for the stem cells. So they tell the stem cells where to come, how many of them to come, what to start healing, what type of tissue to start forming, and to make inflammation happen or to take away inflammation. And so we really want all of those traffic controllers all coordinating in the right way. Only a plane can land if you have all the traffic controllers in place and air traffic control. And you guys can kind of think of it that way. That's probably the easiest way to think of it. And the stem cells are on the plane landing.
So I have one last question for you. So this means that PRP is a great precursor or adjunctive therapy with stem cell therapy?
Yeah, it could be used. So stem cell therapy cannot be used by itself because just stem cells alone, because they're going to sit there and not know what to do. They need the growth factors to tell them what to do, when to do it, and what kind of tissue to turn into in order to work well. And so they're just going to be sitting there kind of blind, not knowing what to do, or they need somebody to guide them to know what to do.
All right, awesome. Yeah. So this is pretty easy. You come into the office, we draw a little blood out, and then we're going to generate growth factors, PRP, with this awesome device.
That's right. So do you want to just kind of go over in general what this system is, how the processing works?
Yeah, and I know that there's lots of offices have different types of devices, but this one is unique.
This one is unique. So this is still a centrifuge. We do still use molecular weight separation, but this also uses optical sensors. So the reason that's important is the optical sensors, if I can take a quick look inside here, the lights here in the back, are actually seeing where the different sizes of cells are. So the reason that's important is that when you process whole blood, there are certain things in the whole blood, like the platelets that Sean just talked about, that we're obviously trying to separate out and concentrate down. There are also adult-sized platelets, hematopoietic stem cells. Again, this is not a stem cell procedure, but they do have a similar molecular weight to some of the waste blood that normally gets processed out in some of these other systems.
Okay.
This system can visually find all of those cells and make sure that we're getting approximately 97% recovery rates from everything that starts in the whole blood side. So a quick view of how this system really works. Put your whole blood into the 60 ml syringe, which is obviously typically extended here. blood processes into our proprietary chamber. This chamber is FDA approved to be reused on the same patient up to 3 times for the same setting. So a lot of times Dr. Herskowitz likes to do bilateral knees as well as hair restoration, something like that. You can do multiple procedures with this one kit in the same system, same patient, no additional incurred cost.
Oh.
Right. So
And only one poke.
And only one poke.
That's important to the patient.
Yes, it is, because what you can do is you can use the exact same butterfly needle. You can lure lock from this 60 to another 60. Draw as many as you need to. Hold those until you're ready to process.
Okay,
exactly.
cool.
Yeah. So the efficiency of this is above everything else on the market. Really, we're also getting about 14 times concentration over baseline in our smallest residual volume.
Wow.
Yeah. How about that? Did we run over significantly?